Hello, Dr. Camila. I am recording this video log because I've been losing my keys constantly, forgetting close family names, and getting completely disoriented driving home on routes I've known for years. I am really scared about what is happening to my memory.
Well, thank you for sending your symptoms, Corazon. Those are significant warning signs. Alzheimer's disease often begins with short-term memory loss, confusion with time or place, and difficulty completing familiar tasks. Let's analyze your clinical data. To understand why Corazon is experiencing these memory lapses, we must look at how the brain normally processes information. In healthy individuals, millions of neurons pass signals to handle thoughts, memories, and movements seamlessly. When these pathways are disrupted, everyday tasks become major hurdles. Based on the cognitive test and brain imaging we review, diagnostics confirm Alzheimer's disease. To explain the exact cause and symptoms involved, here is our research expert, Marifer.
Thank you, Dr. Camilla. This progressive disease directly attacks the brain, the core organ of the central nervous system. The primary causative agents are the abnormal accumulation of amyloid plaques and neurofibrillary tangles. These proteins disrupt cellular communication, causing neurons to lose connectivity and eventually die.
While is there currently no cure, our treatment plan for Corazon will focus on managing progression. We will prescribe cholinesterase inhibitors to help with cognitive function. However, structured daily support at home is just as vital.
As Corazon's family member, I will be managing her daily care. We are setting up cognitive stimulation puzzles, organizing a strict, predictable daily routine, and making sure she maintains a very healthy diet to support her quality life.
In conclusion, managing Alzheimer's requires a united front between medical professionals and dedicated family members. By combining daily cognitive therapy with proper medical care, we can ensure that patients like Corazon maintain their dignity and comfort.
Dr. Camilla, I need urgent advice. It started as a dull cry on my belly button, but now it has shifted into sharp, unbearable pain in my lower right abdomen. I feel incredibly nauseous and I'm really low on a fever.
Reynaldo, the migration of pain to the lower right quadrant accompanied by nausea and fever is a classic presentation of an acute appendicitis. You need an immediate clinical evaluation to check for complications. Appendicitis is a race against time. What begins as a simple ache can quickly escalate into a life-threatening emergency within 24 to 72 hours. Recognizing the exact moment the pain shifts to the lower right quadrant is critical for survival. We rushed Reynaldo's emergency lab results to pull up and read the specific diagnostic data for the lab. Here is Gabriela.
Thanks, Dr. Camila. I have processed the origin charts here. The diagnostic scans show an elevated white blood cell count in an imaging confirms severe inflammation. Marifer, what is the underlying cause of this data?
The affected organ here is the appendix, a small pouch attached to the cecum in the digestive system. The primary cause or agent of appendicitis is an obstruction in the appendiceal lumen, often caused by a fecalith or lymphoid hyperplasia. This blockage leads to rapid bacterial multiplication, severe inflammation, and ischemia.
Because of the high risk of rupture, the definitive treatment for Reynaldo is an emergency appendectomy to surgically remove the appendix. Post-surgery recovery management is the next crucial step.
We are so relieved the surgery went well. Now that Reynaldo is recovering, we are making sure that he takes his prescribed antibiotics to prevent infection, managing his pain with analgesics, and ensuring he gets plenty of rest and fluids for a full recovery.
Thanks to quick diagnostic work and immediate surgical intervention, Reynaldo's acute appendicitis was successfully managed. Remember, abdominal pain should never be ignored. Early assistance can save lives.
Healthcare is not merely a system of hospitals, clinical diagnosis, and medical treatments. It is a fundamental lifelong practice of self-preservation and awareness. As explored through the study of diverse medical scenarios, ranging from chronic degenerative neurological conditions like Alzheimer's disease to acute sudden digestive emergencies like appendicitis, health is a fragile equilibrium. The human body operates as a complex network or interconnected systems, where a disrupt in one organ can ripple across an individual's entire life. True healthcare begins long before a patient enters a doctor's office. It starts with the daily conscious choice to understand how our bodies function, recognize the subtle warning signs of illness, and actively mitigate risk factors. Alas, medical interventions can treat diseases, but intentional lifestyle choices are what sustain true wellness.
For our conclusion, we learned that the importance of proactive decision making and maintaining a healthy body and mind cannot be overstated. Our physical and cognitive systems are deeply intertwined. A decline in physical health heavily burdens mental well-being, just as chronic mental stress or cognitive neglect can manifest as physical deterioration. Taking informed, deliberate actions, such as maintaining a balanced diet, engaging in regular physical and cognitive exercise, and seeking timely medical evaluations, serves as our primary line of defense against illness. Ultimately, prioritizing health is an act of responsibility towards ourselves and our loved ones. By committing to conscious preventive habits today, we protect the longevity of our bodies and the clarity of our minds for the future.